One of the issues when we talk about in terms of this information battle, and again, I keep telling y'all, it's real. We are seeing it every single day. It's what's happening and how we are being attacked, and we don't even realize it. How this current administration is so anti-black, and they have been targeting black people. And so you got lots of people out here. It's amazing, all these people, oh man, Trump ain't that bad and my pocket's gonna be full. Don't even realize, and I've been telling y'all since last year, that there's an effort to completely defund Black America. They are targeting everything. They're targeting politics, they're targeting education, they're targeting economics, they're targeting everything, including our health. Now check this out. Federal lawmakers have almost completely removed the word black from a package of bills that have long been viewed as Congress's main vehicle to address the black maternal health crisis. Let me say it again. They're removing black to supposedly attack black maternal health crisis. This change could hinder efforts to highlight racial disparities and may affect future policy initiatives aimed at improving maternal health outcomes for black women. The shift comes as growing pressure and scrutiny around race-conscious policymaking and DEI initiatives nationwide. Jennifer Driver is a Senior Director of Reproductive Freedom and Health Equity, and she joins us now. And so, Jennifer, glad to have you here. So this is, it's sort of insane. So MAGA wants to say, no discussions about racial inequity. Don't want to hear it, don't bring it up. Well, if that's the case, how then do you know what problem to attack if you remove race? Because to act as if race is not a factor is asinine.
That's exactly right. You know, the controversy around this really centered during April, during Black Maternal Health Week, when the federal omnibus package was reintroduced. And what we noticed was the word Black was removed from the title and largely stripped from the legislative that had been previously called the Black Maternal Health Omnibus Act. And so it was led by Representative Lauren Underwood, the primary lead sponsor and co-chair of the Congressional Black Maternal Health Caucus, Representative Alma Adams, the co-founder of the Black Maternal Health Caucus, and Senator Cory Booker on the Senate side, who was the previous version package. And so, you know, we had seen over the years where Black had kind of, the language had been changed. But this year was really striking with the full removal of the title Black from the title of the package and the legislative language. And as you said, if you don't name it, you can't change it.
Now, explain to people the amount of money that we've lost since Trump got in. Doge comes in. Like, I don't think people really understand that complete wipeout. And we know USAID and how that's impacted Ebola and things like that in other countries. But they wiped out, and they have hindered the work of numerous nonprofits in this health education space.
I think that's right. I mean, not only have they wiped out at the federal government, right? So they've erased the people who were the public health scientists that were studying Black maternal health. They defunded the researchers who were really looking to change how we address the maternal mortality crisis in this country. So across the federal government, you saw just droves of researchers, epidemiologists, scholars who were really committed to addressing Black maternal health. But not only across the federal government, we've seen it in nonprofit organizations too. We have seen where the Trump administration has targeted organizations that are primarily focused on addressing Black health. We have seen our funding has been removed or gutted. If we got federal funding, that funding was cut or removed. There was a lot of layoffs. Decades and decades of research and science just all wiped out with a swipe of what Trump has done. And What also happened was that foundations who were funding and committed, right? So during 2020, all these funders that wanted to come and say that they were pro-Black and stand up, they actually walked away as well. And so you saw them backtracking and say, oh, no, we can't say Black, or actually, we can't say that. And so the funding that was supporting a lot of these nonprofits that were really addressing the maternal health crisis, that funding was gutted.
So the 19th did a story, and they talked to Congresswoman Lauren Underwood. And the spokesperson said this. The spokesperson for Underwood said removing the word Black from most of the legislation in 2023 was due to technical edits related to the Kira Johnson Act, a bill in the Momnibus package named after a Black woman who died in 2016 in the hours after childbirth. The legislation encourages investments in community-based organizations that support mothers. Though it has not been enacted, aspects of the bill have been implemented through congressional funding directed to the Office of Minority Health under the Department of Health and Human Services. These appropriations, first approved under the Biden administration, total more than $30 million to date. So Underwood's spokesperson said removing the word Black in 2023 aligned the legislative text with language used by the Office of Minority Health to avoid future regulatory hiccups under existing regulations. But here's the thing. What we also know is that money that was allocated by Congress under Biden-Harris, Trump and his cronies have been slashing.
That's exactly right. That's exactly right. You know, the funding has been slashed. And so I think it's kind of disingenuous to say that all of this money is going to community-based organizations when the reality is a lot of that funding was gutted and cut. And so, that number is a drop in the bucket of actually what is needed to address this crisis.
Going back to the story on the 19th, it said some of the references to Black people were replaced with demographic groups with elevated rates of maternal mortality, severe maternal morbidity, maternal health disparities, and other adverse perinatal or childbirth outcomes. The latest bill also links to a formal definition for racial and ethnic minority groups that includes Black people. Quote, the definitions in the bill are designed to make sure that the money can get to the communities that need it, Underwood told the 19th, who emphasized the substance of the bill has not changed and has been expanded to encourage more research funding. What do you say?
So one of the most important things about the Momnibus is that it framed maternal mortality not simply as individual healthcare issue, but as a structural and racial issue. The bill recognized that outcomes are shaped by systemic racism, access to care, provider bias, environmental exposures, criminalization, and economic inequality. So not just personal behavior. And so, this idea that it's doing all of these things, but you can't actually say the word Black and who is most at risk. We know that Black women are 3 times more likely to die from a pregnancy-related complication, and a significant number of those deaths are preventable. About 84% of the deaths are actually preventable. And so, I think when you start removing the word Black from these legislation, it's not simply symbolic or branding. In public health and policymaking, naming a population experiencing harms and how problems are measured, funded, and implemented, and how policy is defended matters, right? And so when we're not able to actually clearly name, you can't evaluate the outcomes. You can't ask questions like, are Black maternal mortality rates declining? Are hospitals reducing racial disparities in outcomes? Are Black patients reporting better care? And so, we've done this kind of broad strokes approach to this bill while erasing the very nature of what the bill the package originally was dedicated to do.
This also is interesting here. The article says that obviously Vice President Kamala Harris, President Biden were vocal supporters of Black maternal health policies. But since then, and remember earlier in the article, they said that this money was being delivered through the Office of Minority Health. Well, then it says, but since then, Donald Trump has targeted the Office of Minority Health for elimination amid efforts aimed at dismantling diversity, equity, and inclusion. So they're touting the money's going through, but they want to get rid of this very office.
This administration has targeted Black people from the beginning, right? The Office of Minority Health, it is being gutted. The people that were working there, the access that we had is eroded. And so this idea that we're getting all this funding, that it's still being prioritized, is just flat out wrong, right? It's not happening. And so while there are still folks on the there that are trying to fight through, the scale in which we had previously had is not the same. And that actually needs to be acknowledged. And so what you expect is that Congress would actually grow a backbone and support and establish that Black health matters and that we need to prioritize Black women in this moment.
All right, then. Jennifer, we surely appreciate it. If people want to get more information, how do they reach you?
Sure. I am at the State Innovation Exchange. You can reach out to us at stateinnovationexchange.org.
All right. We appreciate it. Thanks a lot. Folks, let me be real with y'all. If you are on Medicare or about to be, the system is not set up to work for you. Too much fine print, too many plans, and too many people making money off of your confusion. And look, we're used to this. We're no stranger to systems that don't have our best interests at heart. But we don't have to accept it when it comes to Medicare. That's why I'm telling you about Chapter. Their advisors are independent and honest. In fact, they're the only Medicare advisors that compare every plan nationwide. And they're focused on one thing, what actually works for you. If there's a better plan out there, they'll find it. If you're already in the right one, they'll tell you that as well. No games. Just last year, people who switched with Chapter saved an average of $1,100. It's 20 minutes with a real person, completely free. So give Chapter a call, 724-264-8281, 724-264-8281, and connect with someone you can trust.